My name is Vicky. I come from the west coast of Canada. I moved here 2.5 years ago after I got married to my Dutch husband, who's from Eindhoven. To be honest, I really didn't know much about the Dutch healthcare system before I moved here. I knew you had a national program and that it was compulsory to be on healthcare insurance. And for me that was normal because I was similar with that in Canada. But it was really difficult to find any information about healthcare before I moved over here, as everything was in Dutch. So my experience coming here was very limited.
SGE International is a healthcare center tailored to the needs of internationals. Research done in the international community has shown that Dutch healthcare does not always meet the needs and expectations of internationals.
The biggest problem was language. Although I could speak English with other physicians, sometimes with the front desk or even being able to communicate my concerns or my needs about my health, I didn't feel I could really do that adequately.
SGE is now offering healthcare services aimed at answering the needs and questions of internationals, such as, I find it difficult to explain my health issues in a different language. Will the doctor fully understand my concerns? Is giving birth in the Netherlands similar to my home country? Am I able to receive the same medication that I am prescribed at home?
Well, in Eindhoven we have around 20,000 patients that live here that come from an international background, and often it's difficult because it's different from the system that they're used to back home. And although we have a system that is professionally speaking very well regarded, we notice that people with international backgrounds are often a bit dissatisfied with the system. So that's why we wanted to base this service to bridge the gap between the Dutch healthcare and the healthcare that they're used to. We have, instead of a 10-minute consultation time, we have a 20-minute consultation time. The reason why we do that is that we know that people struggle with expressing themselves in a different language that they're used to. And also there are different cultural aspects of healthcare that might be different from the one that they're used to. So we want to bridge that gap as well.
When you first arrive, you can receive an intake consultation where we take the time to get to know you and understand your cultural and personal background. Also, we will give you information about the Dutch healthcare system.
At SGE International, we have a medical team consisting of me, the general practitioner, but we also have doctor's assistants on site, and the team is trained in speaking English, but also in offering intercultural communication. We also offer the services of SGE, which is a foundation that we are part of, and they can offer services in physical therapy, pharmacy, and all other ranges of services.
SGE International has associations with midwives, psychologists, pharmacists and physiotherapists with a special interest for people with international backgrounds. On our website, we offer you a wide range of online services such as repeat prescriptions, callback requests, e-consultation, and you're able to make an appointment with a GP through the website.
My experience with SGE International has been very positive. From meeting the front desk staff all the way to the house arts, and being able to communicate in English has been a really bonus. But also it's great to have that extra time to talk with the doctors about what I feel I'm going through both emotionally and physically with moving here. And they really listen, and that for me is a big benefit. To adapt to the Dutch healthcare has been a challenge at times, but it does make sense too if you listen to how it's explained to you.
SGE International. Understanding your needs.